Morning, everyone. As you just heard, my name's Tim. I'm a GP. I'm also a father of two. One I prepared earlier is down here with me this morning. That's what you get with Saturday morning with kids, and some are going one way with mum and some are going the other way with dad. I actually work at Bupa as well as a medical director, just in their health services businesses and looking at things around health and making sure that our products are useful for customers and doing what they need to do. But today, can those of you who are having your first baby pop your hand up for me? So pretty much everyone. Yeah, dads, put your hands up too. If it's your first baby, you may, who knows, it might not be your first baby, but it's all types. So I just want to go through quite a few things. We've got 20 minutes together. I'll try not to talk too much, which is difficult for me, but we'll see how we go. And just talk around some of the fun things that you've got ahead of you. I know you all come here with a lot of expectations. It's a bit of dog in park syndrome around here with so much things to look at. So thanks for taking a bit of time here. Mums, yes, you are the centre of the world. You are the most important person here. You've got a very large parasite growing at a rapid rate in your abdomen, and it's the focus of your attention now, and it will stay like that for the rest of your life. So looking after yourself, really important. Everyone talks about nutrition, diets. I always tell my patients, look, you just need a balanced, healthy diet. Fruit, vegetables, appropriate amount of meat, depending on what sort of meat you do or don't enjoy. Are you eating for two? Yes, but your second one's only this big. So it's not like you eat double. You just realise that your metabolic rate's a lot higher than it usually is. And having that little bit extra, as long as you know what your weight gain is through your pregnancy, is perfectly okay. Exercise is good. Michelle Bridges got a lot of stick for some of the exercises she was doing through her pregnancy. Quite unfair, because really when you are pregnant, any exercise your body's used to doing, you're quite okay to keep on doing. How many of you here have got a really good exercise program at the moment, even while you're pregnant? Bit busy? No, that's fair enough. Even if you can get out walking, all those sorts of things, get a bit of time to clear your head, a bit of you time, that's the way to go. There's a few things you can't do. Skiing, not a great idea. Water skiing, definitely not. But, your aerobics, your gym work, all those sorts of things, even playing netball, those types of things are absolutely fine. Keeping up your interests is really important too, because, of course, having a baby that's going to become your interest, it'll be a real focus of attention. But as you go through, you've got to remember what are the things I really enjoyed about doing before I got pregnant, and not to lose those and for them to go away from your life. When you get to the breastfeeding thing, I love getting into the breastfeeding debate because there's lots of talk about breastfeeding. Breast is best if you can do it. There's lots of help out there for people who struggle, and some people do. It can be really tough. Never feel guilty if you can't. You haven't failed to breastfeed. Just some people, your body's not made for it. It's not going to work, and away you go. You just go over to the formula feeding. Even if you are breastfeeding, expressing is a really good thing to do. I tell all my new mums, once your baby is 6 weeks old, make sure you give them 1 bottle a week. Usually express breast milk if you're fully breastfeeding. But if you give them 1 bottle a week from the age of 6 weeks, when you get to about 3 or 6 months and you want to go out, your baby will take the bottle. People who just sort of exclusively use the boob up until 6 months, you want to go out, your baby's going to refuse the bottle and they'll go, I don't want it, I just want you, which is fair enough. Whereas if you're doing it just once a week from 6 weeks, they get used to what a bottle is. It tastes the same, it's the same stuff, and it gives you a little bit more freedom down the track if you're going back to work or you want to go away for a weekend or those sorts of things. Just have a greater time away. Just a little trick that I know people have found really useful. Recovery is different for everyone. Everyone says talk to your mum about how they went, but really it's how you'll go. It takes about 8 to 12 weeks for your womb to go back to normal size again, for all that fluid to go away. When you breastfeed, it's a lottery. Some mums breastfeed and they can be lighter than their pre-pregnancy weight because the children literally suck the life out of them. Other mums breastfeed and their kids feed really well, but they don't lose any weight and they're really unhappy. And I say, there's no fault of yours, it's just the way you've made up, and you have to find other ways to get your weight down again afterwards. The dads in the picture, really important to have a chat. Obviously, you've been in some form of relationship such that you're now having a baby together. It's good to have expectations out there on the table. Don't assume that because you're a couple and you've been together for however long, you've got things worked out. Bringing a baby into the picture fundamentally changes your relationship and how you deal with one another. So it's actually good to talk about it beforehand, how you think you might parent, how you might handle it. Work out what dad's willing to do. In the olden days when dads did nothing, that's really changed, but what's dad going to do in terms of helping with the baby, helping around the house, helping with cleaning, shopping, cooking, all those sorts of things. So you've got a good expectation of where you both stand rather than someone getting a shock when the baby's in the way. And once the baby's there, you're not going to have so much time to do those things. Of course, your relationship's really important, and a baby does fundamentally change that. I think it fundamentally changes it for the better. I think it's probably the most unique thing you can share with another person on this earth is to share a child. But don't forget that you are also a twosome. So no matter what's happening with sleep patterns, feeding, bath time, try and get that hour or two a day that you can just have some you time. Look at your resources around you. Lots of people plan a date night, those sorts of things. And yeah, the date night's the two of you. As I said, however many kids are around you, they really get under your feet, especially once they start walking. You've got to look out. They're like these little sort of sneak attacks that you don't know is coming around the corner. Physical stuff, this is the PG version for the Expo today. When you're getting back into the physical stuff that got you out there in the first place, it's really about timing, totally up to the mum. So dads, no matter how keen you are to get back in the paddock, it's really up to the mums to say when. I've got a patient who, her children are 10 months apart. So they got pregnant 1 month after they had their baby. So that's probably the soonest I've had of the people I know. Some people need a bit longer, 4 or 6 months, depending on the people. Any questions at this stage? Anything people want to throw at me from what I've just covered so far? Okay. Sorry, this has got a very sensitive clicker. Broader supports, it's really good to know who you've got around you. People who've moved interstate and left families behind can be really hard to have a good support network. I think your number one support is actually your mothers group, because mothers groups are usually teams of first-time mums in a local area. You've got a maternal and child health nurse who gets you together, and that's a really good way of sharing what you're going through. When you have a second baby, you wonder, you realise that, it was so hard the first time because you just don't know what you're doing. You can be given a guidebook, people can tell you what to do, but until you're there, totally fish out of water. You just lose control and you really don't know what's going on. So any help you've got around is good. Family is good. Culturally, this is really different, I find. Mediterranean and Asian families have really figured it out. They've got huge families, they all get together, they all move into the house. Being a Northern European myself, it's really just mum and dad and that sort of nuclear family. And that's actually a really backward step because you just don't have that support. You're sort of on your own, people come in and go away again. But I think that one where you've really got your family is the village, that's a much better support. So gather anyone you can. If you don't have family in the same city, just see what sort of friends and families and older generations you can have to help out. The older generations all have very different ideas on how to do things because, of course, things change for everyone, but they've still got some really good advice that you can listen to and see if that helps your bub or whether it doesn't. You can just take on board what you need. Your friends will be interesting. You'll have your friends who haven't had kids and your friends who have had kids. And it really does actually define your friendship groups as you go through life. You find that people who never have kids, for whatever reason, by choice or lack of choice, you tend to drift a bit just because people with kids talk about their kids all the time, which you've probably found even if you don't have kids yet and you've got friends who do. Your house is not going to be yours anymore, so if you've just done a lovely renovation, well, maybe you should have enjoyed it for a few years or left it a bit longer. It's going to be a complete mess. You're going to have 30% more stuff in your house that's not yours. You only have to look at everything in this expo today to realise it's a pretty good market to fill up. From a safety point of view, there's quite a bit to do. The safety kits where you buy the box of things that help you protect cupboards, protect power points, really good way to go. Kids who can reach knives, nothing more scary than, a 9-month-old crawling along with a meat cleaver dragging in their left hand. It's not a good look for them, and it's a bit worrying for you. And certainly in the laundry, it's not good seeing them chugging out of the bleach or something like that. So these things are really simple to put on and really fiddly to take off at times, but pretty good. Baths are good. Make sure you do get one of those little baby baths. There's nothing worse than a little baby in a big bath. They sort of start swimming laps and they're slippery little suckers when they're new, so they sort of shoot off out of your hand. Whereas if you've got them in the nice little plastic bin, you find they're even just a bucket, those bigger buckets you can put them in, they're contained that way. If you drop them, you can pick them up pretty fast without chasing them around the bath. It's a good way to go. Pets, keep a really keen eye on your pets, no matter how friendly your dog is and how beautiful they are with children they don't know. You bring a child into the family, you've changed the dynamics and they'll think they're number 3 after the 2 of you, and the child should be 4, whereas you're putting it the other way around. So some dogs adapt to that, some don't. Cats will just stay aloof, they'll do their own thing, they're fine. As long as the baby doesn't prod them too much and make them scratch, they're not such a problem. Baby transport, that's a big thing. There's a good jogger down the bottom there. I don't know if there's one around here, but I can highly recommend that. Baby seats, there's a lot of baby seats to choose from, so make sure you have a good look at them all. See what's going to fit your car best, see what's easiest to put in and out. Australians have made our design standards quite complicated so that it can be really tricky. This one's my youngest and he's 7. When they were babies, the car seats were impossible. You had to go to the RACV or a dealer to get it put in your car, which is just crazy. These days they're a lot better. They're the ones you can click in and pull out. There's the ISOFIX. It's really come a long way and that's good. Shade's really good. Nothing worse than a lot of sun coming in the window on your kid's head. Bit of stuff in the car, so make sure you've got wipes in the car. As I said, your car will just fill up with baby stuff, but being armed with all the good stuff, spare nappies, wipes, those things, so if you rush out without them, get a car that's big enough. 2-door cars, if you've got a convertible, go and sell it. It's just not practical trying to put a baby in the back. I used to have a convertible, no more. And the driving style, I like this story. For all you who are first-time dads, the mums, when you go home from hospital after you have your baby, you'll see a once-in-a-lifetime event, and that's the first-time dad driving his firstborn home. You'll think you got in the car with the 80-year-old granny from next door because he'll be driving really carefully and really slowly. And then you'll have a second child down the track and you'll find he just jumps in the car and goes home because he's used to having kids. But I really remember taking my daughter home when she was born. And I've heard it from friends and family when it's happened to them too. But it's quite an amusing drive. It's almost like having a learner with you. Very cautious. As I said, there's lots of help out there. I probably rate your maternal and child health nurse as your best support when you first have a baby. They're the person who'll come and see you at home after you've had your baby. They will come and you go and see them for checkups each week or each month. They can advise you on immunizations, although you normally go to the council or your GP for those. They get your mother's group together. They're just a really good resource to have, and they're just dealing with babies all day, every day. Hopefully most of you everyone here have a regular GP. I have a regular GP because every GP should have their own GP. If you don't have a regular doctor, go and find one. Often when you're young and fit and healthy, you don't need a doctor much. Once you've got babies, you start going to the doctor lots because kids get sick. So it's good to find a good GP in the area with someone who you're comfortable with and you can trust. Most of you will probably have an obstetrician or a midwife or even a GP obstetrician at this stage who you're working with. They won't be as important once you've gone through the delivery, although that's sort of the next big stage for you all to go through. And the bottom two are super important. You'll find kids, as a tendency, your dream baby is one that feeds well and sleeps well. As I said, they're a dream. You're dreaming if you think you're going to get a baby who sleeps well and eats well. Although you've probably got some friends who do have one. I never had those. My kids, both awesome feeders, shocking sleepers. You might find some that sleep beautifully, but you have real trouble getting them fed. So lactation consultants are worth their weight in gold. They're really good. I've seen some pretty horrible things happen to breasts through bad feeding, and you can actually have that not happen if you just get the right advice. And you start with that in the hospitals, but people can come to your house or you can go to them once you're out of hospital if you're having trouble breastfeeding. A lot of GPs can help too, but lactation consultants are certainly that step above and that bit better in terms of having hints. Sleep consultants as well. Many of you might have probably know about centres you can go to. You can go there for day courses or you can go there overnight and get a couple of good nights sleep while they help settle your baby. There's also people that will come to your house. There's a group called Sleep Rescue, and they can come in for 3, 4, 5 hours and see what patterns your baby is doing and give you advice on how to get your baby to settle better. But don't think that you're lost. There's no help out there in how you're going to survive this, because it's sort of the biggest adventure in life. It's the highest and lowest of emotions. A lot of people think, oh, geez, I'm a bad parent. No one's a bad parent. It's just that it's hard to be a parent. And so we all learn as we go. But there's lots of help around. I like to talk about immunisations because that gets lots of media. I'm certainly in the medical media, but generally too. I'm very pro immunisations. My kids are both fully immunised. I see immunisations as a victim of their success. I've been in general practice nearly 20 years, and all the things we immunise for, I've never seen. Many of the things we immunise for, doctors who are 10, 20 years older than me, they were the emergencies. I like to talk about Haemophilus, which is a bacteria. It's in one of the immunisations. There's an illness where the flap that falls over your windpipe when you swallow, to make sure it doesn't go to your lungs, there's a bacteria that will get on there and cause an infection, and it swells up that flap such that it obstructs your airway and basically chokes the child and kills them. So 20, 30 years ago, that was a medical emergency for a GP. I have not seen that in 20 years as a doctor, and that's thanks to immunisations. So a lot of the bunkum about immunisations is actually false. There was a lot of talk about autism and measles. Mumps rubella vaccine, that's been shown it was fiction, it was made up. So it's actually wrong. Yes, there's a risk with immunisations, certainly a sore arm, and there's very rare, sort of 1 in 100,000, 1 in a million risk. But people who get measles and end up with, that can kill kids. You can have chickenpox that can give you a brain infection, so meningitis or encephalitis or pneumonia. Some pretty horrible things go on. So I'm very supportive of it. I'm always chat to my patients about it and very open to it. A lot of people say, oh, can we break them down and do less? Because you give 2 needles and there's 4 and 1 and 3. That's 7 immunisations. Geez, that's a lot. Well, your immune system is so sophisticated and so clever. You could throw 2,000 different bugs at it at one time, because we've just got this defence system all the time. 2,000 different bugs, and it'd go no problem. It would deal with them. So if you're worried about having 7 or 8 things in one lot of immunisations, don't be, because it's barely just sort of brushing the surface as far as our immune systems. It's really well developed. So have a look at what you want to do. Have a chat with your doctor. I understand people have different views on it, but the best thing is to get really well informed and not read sort of the hysteria and the fiction that's out there. The resources, I wrote this deck a long time ago, so I've got no idea where I put bags up there. But you'll find you get advice from everyone. You should do this with your baby, you should do that, you should do the next thing. My advice is listen to it all, but your baby will be an individual. No other child will be like yours. So certain things will work for them, certain things won't. So try everything out you hear, or listen to things and think, oh, that might work, knowing how my child behaves, and use what you need and throw out what you don't. If people are trying to be really dogmatic and say, you must do this, you go, well, no, I don't have to do anything. It's a matter of knowing what's going to work best for my child. Just to finish off, the baby, what is it? Well, if you think of what a baby is, it comes out, it can't feed itself, it can't talk to you, it can't move. Its primary way of communicating you is to scream or gurgle or vocalise. It's amazing what a small set of lungs can produce in terms of crying and making a racket. So it behaves this way because really what does it need to do? It needs to feed. Its number one thing is to feed so that it can grow. So it's getting used to all these sort of lights and sounds. It doesn't have a really sophisticated view of the world. It knows you really well by smell, knows mum super well. Mum is the milk bar. She's like the chocolate of the baby's life. So often you'll find when you need to settle a child, don't send mum in to settle, send dad in. Because although knows dad's smell, it's not like dad's a feed. So there's all sort of little things you learn. You've got to think on a really primitive level as they go to it. And of course, they're going to scream to control you. I am always entertained by 30-something parents with a 2-year-old or a 1-year-old who's running their life. And I go, age difference? Who should be running who here? But that's just the power of a child. I mean, that's their role, is to make you do everything they need so they've got the best opportunity to grow up into an adult. So it's a normal reaction you have to them, but it's about remembering that actually you're the boss, not them, even though they're going to try and do that. First-time syndrome, as I said earlier, you'll feel like you're all out of water, I don't know anything, I'm a bad parent. No, you're not. You're just like every other parent. It's a beautiful thing. Second time around, it's so much easier because you know what's happening, but it's still hard because you got the first one running interference. But when you've got the first one on their own, it's just this sort of magical mystery tool where every day is a new day. The general rule for a first-time mum is if you can do something on one day that you don't have to do every day, that's your win. So that's your small win for the day, because every day you get up and you've got all the stuff you have to do for the baby, and even if you get in the shower, that's a win. But if you can do something else that's just stand out on its own, consider that a good day. How to react in a crisis, as we say, first take your own pulse. Stop, take your own pulse, take a deep breath, stop and listen, see what help you've got around you. How many people here have done first aid? Good. So if you've got a basic idea of first aid, that can be really helpful if something happens to your bub. I always rate mother's intuition too, because as you get to know your baby, you'll get a good feel of whether it's something that's a little bit out of the ordinary for them or whether they're just a bit down. So certainly as a practicing GP, I always listen to mothers and I say, look, you listen to your own intuition. I'm sending you home. I think you're going to be okay, but if you're getting a bit unsettled, if you're thinking maybe, act on it right away. So do trust in yourself. That's about all we've got time for today, so thank you very much for all coming. I'm happy to stay around to answer some questions, but we're all done now. Thank you.